or to win that gold medal, you need to have the proper.
Now, so for somebody who hasn't exercised,
Are you a seasonal runner? Are you like like occasional runner? Strength training is very important. Most important is the balance running itself. It's a repetitive stress. If your body and you're not prepared for the run, the injuries will come along.
Hi everyone, I'm Ziyad from Qatar running series, Z-Adventures. And today I am with Dr. Mahesh Reddy. He's a consultant, orthopedic and sports consultant at Aster Hospital. So today we're going to talk to him about everything pertaining to running, which is the runner injuries, the treatments, the precautions that we need to take, and everything in between. So welcome, Dr. Reddy.
Yes,
It's
thank
so
you.
nice to have you.
Thank you, Ziyad. It's really a nice opportunity to talk to you. I myself have heard that you have completed more than 220 marathons across 100 countries, and the founder of Z-Adventures and the man behind Qatar running series. So it's a really wonderful thing to do, and who more than the right person to talk about athletes' injuries and runners' injuries and preventions than you.
Absolutely,
Yeah.
absolutely. Thank you so
Thank you.
much. So we're going to start off with a series of questions pertaining to common running injuries.
Yes.
Now, I'll give you a little bit of background. If when you ask a runner, about his injuries and stuff, and you ask the runner's wife about his issues, so she'll come up with something different. So
Yes.
according to a family member, a marathon runner usually has mental health issues. But we're not going to get into that because that's not your area of expertise. We're going to concentrate more on the running issues, the issues that are related to running, the injuries, the precautions that runners need to take, and if they're injured, what will happen and how to amend it. So we'll start off with the three basic running injuries that runners face,
Yes,
especially long distance runners. One of them is plantar fasciitis. The other is knee issues, which is very common amongst runners, and something not so common, but still it's getting a bit common now, are the hip injuries.
Yes, definitely.
So we'll start off with knee injury.
Yes.
So what is a knee injury? Why does it happen in runners? And what are the ways where runners can ensure that they're physically fit, or precautions that they take to avoid such injuries?
Yes. So first and foremost, we need to start off with what type of runner are you? Are you a seasonal runner? Are you like like occasional runner? Are you like trained to be a marathon runner? So the most when you're a seasonal runner or like a weekend warrior types, when you're not prepared, your body is not prepared, and then you start overloading your body, especially the knees, the ankles, and the hip, the pain starts coming. So basically, the underlying message should be that if your body and you're not prepared for the run, the injuries will come along. So preparation for the run, that is the strength training, that is your balancing, and that your age appropriate. And then most important is of course the footwear. Half of my patients treatments is as simple as just changing the footwear. So having a age appropriate strength training, and then following that appropriate footwears will definitely help in terms of injury prevention and what to look forward in a run.
Okay, that's good. So say take an example of an office-going person.
Yes.
Say he's 30 years old, he's got a desk job, and somehow somebody tells him, what, let's do a marathon.
Yes.
Right?
Yes.
So basically a couch potato to a marathon runner.
Yes.
Now, normally when you see online, there are training schedules and stuff for the marathon training, and it ranges between 4 to 6 months.
Yes.
So you follow the training schedules, which tells you to do 3 to 4K a day, and then you do some hill training. You do some fartlek sessions, and then on the weekend you do long runs.
Yes.
Now, so for somebody who hasn't exercised in say 10 years or so, or been on the computer, would you recommend him to get into that program? Or would you ask him to complement that program with some other training or activities?
Definitely, when you do such a stressful activities,
Yeah.
like marathon running or running itself, it's a repetitive stress which
Right.
keeps on happening in the knee, throughout the body, I can say, especially where there is a lot of stress in the ankles and knees.
Yeah.
When you run, the amount of stress within the knee joint increases substantially when you run.
Okay.
So, when a person who is unprepared, you just go ahead, just motivation is different and discipline is different.
Right.
So definitely, when you just go ahead and just run such a programs, you are only just inviting recipes for more trouble or injuries. Okay, so definitely you need to get into some training program, do some strength training, some balancing, followed by definitely the weight loss.
Yoga.
Yes, yoga. Yes,
Yeah.
that's also quite okay. And then strength training is very important. Most important is the balancing. Okay, so as a person who, let's just take an example of a person who has never run. So most important thing in running is alignment. Are your knees aligned? Are your ankles aligned? I know it's just a very vague thing to say. General person, like how can I know my alignment is like just wrong or what? So I'll just give an example. Why do you think there are the African part of the people are winning Olympic gold medals in running? You see, if you just do a biometric study, the limb alignment and the limb length in the such kind of a set of people is same to a decimal, to a 0 point decimal, compared to many other people. So what I'm trying to say is that to push that extra strength or to win that gold medal, you need to have the proper alignment. But I'm not saying everybody is going to be having a perfect alignment, and but you can just have a check with your orthopedic surgeon or doctor that how is my knee alignment, how is my ankle alignment, how is my hip alignment. If you want to program such a stressful activity like a big marathon or something. Why I'm talking about alignment is just, let's just take an example of a car. If you have a wrong wheel alignment, you see one part of the tire wears out faster. So in our body, it's not the tire, it's a cartilage which wears out faster.
Right.
Once a certain level of wear out is there in cartilage, we really cannot do anything in terms of preserving the cartilage, the injury preventions and all. So the most common things I see and prevention thing in such a program is that first just check your knees and your ankles and your hips alignment. You can check with your doctors. It's just a common x-rays. It could be an alignment x-rays, just to check with them. Followed by, of course, the muscles, the strength training of your quadriceps. Are you overweight? Are you going to put more stress by this running on the surface you're running? So it's all quite important that you look into all the factors. Because once such an injury happens, and then you have an injury in your knee or ankle, then it can immobilize you for quite a long amount of time. So to prevent all this, first check your knee alignment and see your strength training and get into programs which do all these things, definitely.
Excellent. So a runner, he goes and does a 5K run.
Yes.
See, for training purposes. Comes home, complains about his knees.
Yes.
He puts on like some ice pack or something, goes out again, does another 5K and all that.
Yes.
So over, say, after 3 or 4 weeks, the pain becomes kind of severe.
Yes.
Now, is that the time that he needs to go visit an orthopedic surgeon or a specialist, or he's past that time? He should have come earlier.
Yes. So it's very, very important that you see such kind of an issues, the pain, the swelling. If it's coming in the first attempt, try to meet a doctor, definitely. If possible, a sports specialist doctor who can guide you better. Of course, as I mentioned, motivation is different from discipline and what is your body capability. Okay. Do not, yes, of course, a human body can push the boundaries, but is your body and age appropriate to that? Is the most important thing you need to understand, and that understanding can be helped with the help of an orthopedic surgeon or a sports surgeon who can guide you better. So when you have a pain, swelling, or in the knee joint or any other joints after a stressful activity, it's better you try to meet a doctor, and so that he can give you a better understanding of your own body. Just not for for the medications, for the gels or something, but just to understand, where am I, what can I push, what I should not push, and where is the strength training in this, and then you move forward.
Now, and I mean, I meet a lot of runners all over the world, and
definitely.
a lot of the runners, including myself, I mean, we're mostly in denial
Yes.
that, you know, we have an injury. We just say, well, we just had a
Yes.
bad day, and, you know,
Yes.
I didn't sleep well, and this and that, and maybe I tripped over a rock, that's why my knee hurts.
Yes.
That sort of thing. So a lot of runners are in denial, and they're afraid of going under the knife.
Yes.
Now, to a runner, what would you say if the last resort is surgery? I mean, what is the end game for them? What's going to happen to them afterwards
Yes.
if they have to go for a surgery? And is surgery the last option?
Yes. So surgery is definitely not the last option, and if need be also that we do have a lot of rehabilitation programs where you can get back to your peak level, and then initially the surgical method itself is not the last resort. First and foremost, as I have mentioned, it depends on what kind of an injury it is. So let me just break it down quite easily. So you have a pain and a swelling.
Yeah.
You go to a doctor. He does your X-rays and ultrasounds, and then you get a vague idea as into how is your knee and all this. And then doctor talks to you about in terms of where are you, and then following that, if required be, then you go to an MRI scan, and then there we get to know your cartilage mapping, what is the cartilage, your ligament status, and everything. And say for bed, like you have a meniscus injury or an ACL injury, yes, definitely you can. All the knee problems do not end up in surgical interventions. You do have some exercise programs where it can help you to avoid surgery also, but definitely you cannot push an imbalanced knee.
Right.
Okay, so which is not stable. Okay, it's as simple as like you cannot dance on a platform, which is quite unstable. So you need to have that fixed in terms of surgical interventions. Following the surgical interventions, you do get to go into a lot of physiotherapy, then rehabilitations, then you can get back to the peak level with particularly the discipline towards your strength training. You can get back to it with the ACL techniques, with the meniscal repair we have. We can give you the best graft, the best fixations, and followed by the best surgical techniques to get you back in the game as soon as possible. So knee injuries doesn't mean the end of career. It's just a break in the career, followed by your rehabilitation and getting back with the motivation and discipline to get back into the game to the peak level.
Excellent.
It just takes
Thank
time.
you. Okay. So suppose, I mean, a runner reaches that point where he needs to get a knee surgery.
Yes.
Now, how long after a knee surgery would a runner be able to run again or
Yes.
walk again, run again,
Yes.
and be competitive again?
Yes. So it depends on what type of knee injury that is in. So whether it's a meniscus injury, whether you have, that's what I see in everyday OPD, the surgical cases, the sports injuries. So whether if it's a meniscus, ACL, PCL, the lateral, the outside ligaments, the patellar tendon, a lot of tendon issues and the cartilage issues, it's quite common. So if you're looking at in terms of an ACL or meniscus injuries, then you're looking at least 7 to 9 months of recovery post a surgical period. Okay, that to get back into the peak level of running. This is of course followed by a severe course of rehabilitation, and then followed by you have strength training, you have balance training, you have got proprioceptive training. So all of this training you can get back to the peak level probably into 7 to 9 months post the training. So it depends on what type of injury you have.
Okay.
If you have a cartilage injury, say in that sense, then you might need to undergo cartilage procedures. That can take a little bit more time, probably 9 to 10 months for the recovery and all that. But arthritis knee, in such kind of a condition, say like you need to, God forbid, it's the maximum, like you really cannot do anymore. Like arthritis is such bad. Like if you go back to a knee replacement, these days we got such good implants with techniques. You really do not have to let go of your running or your athletic performance. It's just a break in a phase of your life, as long as you got a good strength, that is your thigh muscle. So strength training is definitely something which I always emphasize.
Yeah.
Even when you're 12 years to 30 years to even 70 years.
Yeah.
So strength training really helps you in terms of recovery and faster movement post any surgical procedure. Yes.
Okay, good. And what would you say to people who are in their 40s
Yes.
and they're running?
Yes.
Now, in order to avoid injuries, what do they need to do more than somebody who is in their 20s or 30s?
Yes, yes. So as you just mentioned, 20s and 30s, these injuries never do come out until unless it's quite evident, like a flat foot or a patient who's having quite a deformity from the childhood.
Right.
The 20s and 25s, you always get away with because you're quite young. Your body is more resilient than 40s.
Yeah.
So when you come to 40s, the body, the healing capacity, the response is definitely quite less compared to when you're young. So first and foremost, when you're a runner at 40s, first and foremost, you need to just get your strength assessed. Start with your strength assessment of your thigh and quadriceps, okay, the thigh muscles.
Okay.
Followed by the alignment, as I have told you before. And then following that, the most important is, of course, the footwear. And then pre-marathon or pre-running, if it's just a short run, probably a workout or stretching and warm-up is very, very important. I really cannot emphasize more on the warm-up sessions prior to the run. There are a lot of injury prevention programs. If you're like especially for the ACL, there is a FIFA 11 plus programs. So these are all injury prevention programs. These are set of exercises which you do before the game, which can help you prevent these injuries from happening. You should be doing this before every game. And then when you have generally like a 40 plus man, there is also a program called functional movement screening. This functional movement screening is also a set of exercises or a set of movements which you do, which are assessed by a professional, which they can tell you that you have either tight hamstrings, you have a tight back, or your balance is off. So it's very important that you get assessed in terms of functional movement screening to prevent the injuries from happening in first and foremost. And this functional movement screening is not only for 40s, even for when you're 10 years, 20 years, 30, 40 years. So following that, the screening, the professional gives you a report as into you have a tight hamstrings, you have a tight back, so you need to concentrate more on the stretching in that area. Say like you have a tight hamstrings, you need to do like a lot of hamstring exercises and stretching, strength training, and imbalances is quite common in 40s because of the sedentary life. So that needs to be addressed, and then following that you can just get back to your game, and it can prevent your injuries to quite a substantial level. Yes.
And are these available in Qatar?
Yes, definitely. I also guide patients in terms of functional movement screening. Our physiotherapists also do assessments, and then in terms of functional movement screening, where is it, what is it, and how are you imbalanced, balanced. So all of these things do help you to know, your body better, from the professional point of view, to look into, where I can work on it to prevent the injuries. Half of the surgeries I do, not even half, more than half of the knee injuries, the knee surgeries could be actually prevented by following a proper protocol. Of course, we have a lot of weekend warriors in Qatar. So, and it's always, I played my badminton, I played my friends called me and then I went along, I twisted my knee and I twisted my ankle and I broke my thing. So, such kind of incidences do come, okay, but so strength training and as I told, the injury prevention programs, the stretching, the quality training, it's really, really important. Yes.
Okay, nice. So now we're going to focus on the second part of the injuries that runners face.
Yes.
Now, one of them is the first one we talked about in detail is the knee.
Yes.
The other one is plantar fasciitis.
Yes.
So what is the reason for plantar fasciitis? What are the symptoms?
Yes.
And what is the prevention and cure?
Yes, so plantar fasciitis is quite common, and when you're touching 30 plus, that's when the quality tissue comes down. So let's break down into what is plantar fasciitis. So plantar fasciitis is it's a condition where there is fibrosis of the plantar fascia. It's a band which extends from your heel to all your fingers. So the reasons for the plantar fasciitis can be like a plethora of conditions. It could be because of your tight calf. It's either your improper shoes, or it could be you're on bare surfaces for quite a long time standing. followed by a tight band, the plantar fasciitis band, or your flat foot. If you could, as simple as you could be having a flat foot or any ankle imbalances, that could cause plantar fasciitis. So the treatment protocol in this is first and foremost, plantar fasciitis is quite common in any orthopedic consultation. So first thing we do is of course the X-ray, and then the doctor says that you have a heel spur and all these things, and then followed by the patient gets scared, like is it something quite bad or something that way? Yes, it's definitely not a very bad condition. It's quite treatable, but assessing what is causing the plantar fasciitis, is the most important thing in this. So again, knowing the thickness of your plantar fascia, that is through the ultrasound scan, okay, and knowing what is, there can be some neurological conditions which can mimic plantar fasciitis, but it's not plantar fasciitis. It can be because of a nerve which is getting compressed. So it can mimic in certain conditions. So you might even need to meet a neurologist for such kind of a conditions. But quite commonly is just an X-ray and ultrasound can give you the condition. I mean, what stage are you in? Coming to what is causing this, as I mentioned, it could be a tight calf muscle, as simple as that, or your footwear, or your walking barefoot, probably with an underprepared body, where your foot pain is because of some arthritis in the foot. So all of the conditions have to be assessed. So treatment options are quite, first and foremost is definitely some analgesics, the physiotherapy in plantar fascia stretching, and then if it becomes little severe, then we got plantar fascia night splints to stretch your plantar fascia. The most important treatment in plantar fascia is to do myofascial lengthening. It is something where you do a lengthening of your calf and your Achilles tendon, followed by the plantar fascia stretching. So the stretching exercises and the icing, the treatments, it really does help a lot. And then of course the medial arch supports. Okay, the arch supports are the most important things. I really cannot emphasize more that if you have a flat foot, you should be on arch support most of the time to prevent further arthritis and pain in the foot. So the next option is, of course, we do the physio, we do the dry needling, we do the treatments, and we do myofascial. I think sometimes they still have certain amount of pain. Then we got injectable treatments, that is the PRPs, the steroids. Okay, so the PRP is more in terms of, it's like a fertilizer type, it improves the quality of the tissue, because plantar fibrosis by its nature, it's just the quality of the tissue is deteriorating. Okay, where there are microscopic tears in the morning, it becomes quite painful when you touch your heel first time in the ground. So the preventions, as I told, all this, the shoes, the first assessment, get it assessed first, what is the stage you are in and what is causing this, followed by all the methodologies. Next, you have the PRPs and the steroids, as I have mentioned. Then, of course, we do all the methodologies, and sometimes some patients, it's not quite common, but it does affect. I mean, it does affect some people after all this treatment. It does not come down, so we go ahead with a surgical intervention. But the chances of that happening are quite rare. That is a plantar fascia release. But it's quite rare.
So, Dr. Reddy, we've spoken about the knee issues that runners face. Now, the second biggest issue, the injuries that runners have, is plantar fasciitis. What is plantar fasciitis, why it happens, and what is the cure for this problem?
Plantar fasciitis is not only quite common in runners, it's also quite common in general population, even in office goers or in housewife, quite common in housewife and teachers, even in surgeons, because of the standing position for quite a long time. So it's a condition where there is thickening of the plantar fascia, that is, it's a band of tissue which extends from the heel to the fingers of all your toes. So first and foremost, it's very important that you get it assessed, as into where do you stand, whether if it's in like it's in the early stages or in a mid stage or in a severe stage. When you go to a doctor, first he does is an X-ray, and then you see if he comments like is there any bone growth or a heel spur. Or when you get an ultrasound scan, it's very important to get assessed with the thickness of the fascia, how thick is the fascia, where do you stand. Followed by, then it can be as simple as the plantar fascia stretching exercises or your calf muscle stretching exercises, because it's very important you get assessed what is causing this plantar fasciitis. whether it's your body weight, whether if there's any arthritis in the ankle, whether it's your flat foot, whether it's the calf tightness. So it's very important that you get these things assessed, because it's plantar fasciitis is not just medications, it's rehabilitation and physio and your stretching. It's just not medication. It's plantar fascia can never go with just medications itself. Followed by orthotics, the footwear, of course. Having a medial arch support, the arch support foods. If you have a flat foot, it's quite important that you use it in plantar fascia. After assessing what stage you are in, and then you start with the physiotherapy, there's some dry needling, there's a lot of modalities in physio, and then the stretching exercises you do. Even after that, if it doesn't help you, then we go ahead with something called as PRPs or a steroid injections. These are, it's basically steroid injection is to decrease the inflammation and the swelling, to give you a little pain-free heal, so you can do. But it's not quite common these days, and then we go ahead with the PRPs. It's like a fertilizer to a tissue which is being devoid of quality. It's like a quality issue. So because of this, so we are giving you a PRP to increase your quality of the tissue. It's not a guarantee that all the PRPs work, and then your exercises, the reason for your plantar fasciitis is knowing those reasons is quite important. Followed by, it's very rare that a plantar fasciitis goes to a surgical intervention, because its chances are very less, because these days with the good exercise programs with injectables and releases, so you got a good outcome. So surgeries is quite less. If you're doing a surgical intervention, probably it's it's usually very late, after all the modalities have failed. It takes a couple of years before you say somebody, you need a surgery for a plantar fasciitis. So prevention, knowing your problem and how to deal with the problem, whether it's footwear, whether it's your ankle itself or your body weight, it's very important you get it assessed before you look into the surgical options in plantar fasciitis.
Very nice. Okay, so now we've discussed the knee issues,
yes.
We've discussed plantar fasciitis. Yes. Now the third biggest problem runners face are hip issues.
Yes.
So why it happens?
Yes.
What can be done to alleviate that pain? Yes. And what is the worst case scenario? Like, is surgery an option?
Yes.
And once you go under the knife, what are the chances of getting back into running?
Yes. That's a very common question we see in the OPD. So hip pain doesn't start always in the hip. It can start from your ankle or from your back. As I mentioned, that a person with a flat foot or an improper shoe wear can the biomechanical alignment, all of these factors affect the hip joint in terms of running. Running, it's not just running, the general health itself. You're walking, jogging. Yeah. Followed by, first and foremost, is that you need to get assessed. Of course, when you go to have a hip pain, you meet a doctor, he gets the X-ray done. Yeah. So the problem with the hip is that just with an X-ray, it's not very informative. Okay, it's quite difficult to derive. When you have a runner's knee, it's never the arthritis always, because hip joint doesn't end up in arthritis is quite common. Unlike our knee joint, it's a very good joint. Biomechanically, it's quite a very good joint. So arthritis in hip is quite less chances compared to the knee. So after you have hip pain, post-COVID, after the COVID period has come, because there was a lot of steroid intake for the treatment. So many times before the COVID, we had just an X-ray, we had a hip pain, and then we had to give some anti-inflammatory, some physiotherapy, people are happy. But post-COVID, many times we need to get your hip assessed through an MRI scan. Okay, we really need to see your if there's any cartilage damage or your avascular necrosis, because the avascular necrosis is where the ball starts having a devoid of blood supply. This has become quite common post-COVID because of the steroid intake when you are admitted in any ICUs or something. So post-COVID, our protocols have changed. Any man, any woman who comes to us with a little bit of hip pain, if they give us a history of COVID, who are on a lot of long-term steroids, we directly just go ahead with an MRI scan, because X-ray itself cannot give you a good brief this thing. So say like a runners, we'll example. So it could be some simple as a labrum injury, that is the covering of your hip joint. That's one of the most commonest thing. Or the arthritis or something. Yes, definitely when you have hip level of arthritis to a certain level, we do have a lot of options in terms of, as we said, PRPs. We have stem cells to at least to preserve your hip joint, the cartilage areas, and then followed by if you have to, if God forbid, like if it's arthritis is in a severe form, then we need to go for a hip replacement. And even with the hip replacement, with the implants and the methodologies we have today, you really cannot stop your game. And hip replacements have one of the most wonderful outcomes compared to the knee joints because it's surrounded with such a good bulk of muscle. So I have my patients going on. We have the elite athletes in our OPD. We have elderly patients in our OPD. Even with hip replacement, they can go for trekking. You can go for your run. All the modalities can be done. So hip surgery, if you have to go under the knife, it is not the end of story for you. As long as you have a good bulk of muscle. That is the reason I have always emphasized that strength training is quite important. So the hip surgeries are not an end story of your athlete journey.
So what kind of hip surgeries are you talking about? Is it the keyhole surgery or a full hip replacement?
So it depends on what kind of issue the patient is facing. If it's just a cartilage issues, it can be definitely done through your keyhole surgeries. When you have a labrum injuries, when you have any PRP injections or a stem cell injection, the BMAC injections, we do it through the keyhole surgeries. But if it's the arthritis is in an advanced stage, where any cartilage procedures cannot be done, or there's any deformities in the hip which you have been having it from childhood, so that such kind of surgeries need open surgeries. But even post that, you do not have to have a end story for your athletic journey.
Thank you. Now, I'm going to ask you some questions regarding the injuries that are faced by men and injuries faced by women. Now, are they pretty much the same, or women are prone to more injuries, or men are prone to some other sort of injuries?
Yes, so that's quite a very good question. I'm very happy to answer such question because, as I mentioned before, 20s, 25s, you boast about I have never seen a doctor, blah blah blah. But 30 years, you need to have a best friend as one of your doctors because the body is not very resilient. When you're 40 plus, let's talk about 40 plus men and women. Of course, the bone density really matters. Okay, so a menopausal woman, I always in all my talks, I always emphasize that post your menopause, especially women, every 3 to 4 years is better you get your bone density checked. Okay. So because you see a video, you saw your friend, you get motivated, and then you go ahead and then you have an osteoporotic fractures. We have done a lot of surgeries in ladies who have just fallen down from the chair and fractured their wrist. So quite common in women compared to men, as we have discussed. That the osteoporotic fractures are very common in women compared to men. So it's very, very important that you get your bone density assessed post 40 or 45 years. These days, the protocols are coming that it's very important even for men, 45 plus, to get your bone density checked to where your bone density is, and then following that if you need any supplements or you need any medications, and all of this do help. So yes, the short answer is men and women in bone health is different because women especially need early addressing, especially from 40s itself, in terms of assessment, the bone health to be checked, because the mortality of one fracture in the hip when you are in 50s or 60s after a hip fractures, it's quite substantial. It changes your life. There's a lot of deaths post hip fracture in women when you are in 60s. It's quite simple of like you go out on your veranda and then you just had a slip, then you have a hip broken. So this could be as prevented as you need to start this journey 10 years back, not that day. So when you're 60s or something. So as I said before, that checking your bone density, that is a DEXA scan or a bone scan, is quite important every 3 to 4 years, and address that issue so that you can have a happy, active old age. Everybody's going to get old ultimately. So that needs to be assessed. And having a happy old age is better than just painful old age.
Absolutely. Now we've discussed all these injuries and stuff. I'm going to ask you $1 million question.
Yes.
Is running good for you?
Yes, of course, running is good
Okay.
for you. I always do encourage it.
Okay.
But having a correct assessment, as I mentioned, the alignment, the proper shoes, are you built for it, or is it just an overnight motivation, all that matters a lot. Whether it's your imbalances in your knees, the thighs, or your hip joints, or you have a back issues. So you need to get it addressed before you can think of running a lot. Okay, I'm talking about marathons, I'm talking long runs.
Yeah.
Short runs are quite fine with just stretching and other assessment with your gym run. But when you're thinking about marathons, when you're thinking about running quite long, you need to get into some running programs. And then, if possible, even if you have an issues of ankle or a knee, get it addressed. Just get a check X-ray, or just go to check an MRI if you have an already existing knee injury. Do not push an injury. Okay, it will actually, if you do not if you do not stop the injury will stop you eventually. That's one of the most important thing as a patient. You should always know that I'm just pushing through my injury. I'm pushing through my injury. It's quite wrong. You need to get it addressed, because you can get it solved. You need to first, if you know what is your injury or what's the condition. So running itself is definitely encouraged with proper assessment and proper tools to get into running. Yes.
Now let's move on to diet.
Diet.
Now, how important is diet for a long distance runner?
Yes.
What sort of diet he should avoid?
Yes.
What sort of diet he should, have more of?
Yes.
So now, internationally, I mean, I run marathons all over the
Yes,
world, and
that
I
you do.
come across so many runners from. So we've got vegan runners
Yes.
who can swear that since they became vegan, their body health and everything has totally changed.
Yes.
And then I've got meat eaters
Yes.
who say that they can't run if they don't have, a big steak.
Yes.
And we've got, say, vegetarians.
Yes.
So what is the ideal sort of diet for a marathon runner? Basically, what they should avoid and what they should have more of before and after the run, or training for an event.
Yes. So when you're training for an event, first and foremost it's as simple as first and foremost check your body weight.
Okay.
Where do you stand?
Yeah.
Where do you stand? If you're an overweight patient and then you're motivated to run, and then like the preparation for that. Overweight patients do come back to us with a lot of injuries, and then you have a long run.
Yeah.
So the diet wise, first and foremost, control your diet in terms of weight loss. That is the dietary intake. Next one, it starts with, of course, the high protein intake, especially in terms of when you're a long runner. Okay, the body weight loss really does help. And then followed by a lot of protein diet, followed by, even in vegan, we do have a lot of protein diet. And then carb loading should also be a little bit reduced. Okay, in the initially, but of course, before the runs, you do have a lot of carb load and all this thing. But prior to that, of course, for the practice runs, you don't need to load a lot of carbs. Compared to your vegan diet and meat eaters. So what I have seen, one of the most commonest thing in these diet changes is that people who are having way less protein, way less, like a dietary component in terms of micronutrients with your walnuts, your blueberries, and and then I have absolutely avoided all the things in my life. So I just want to do weight loss, and then you go for marathon training. They always come back with knee pains, with your shin pains, and all of this. And the most important thing, I have always forgot to mention, is the vitamin D's. Okay, check your vitamin D's, check your magnesiums, check your calcium. All of this is quite important. And then followed by supplementing all this. So the diet wise, yes, always have a weight loss program. Too much of carbs definitely is not advised, because we do advise carb loading, but on certain occasions the loadings, and then followed by little high protein diet when you're a avid runner. Yes.
And obviously, if you are overweight, you're putting excess weight on your joints.
Yes.
So you will get injured,
Yes.
more or less. So say for a vegetarian,
Yes.
if somebody's a vegetarian and he wants to do long distance running, what sort of carbs or protein does he need to take in his diet?
Yes, so that's a very good question, because first and foremost, when you're a vegetarian, always check your B12s, vitamin B12s. We need to get that assess checked. So when you need to have a lot of greeny leafy vegetables like spinach and the palaks, and then followed by your if you're the soya beans that which can have in terms of protein intake more, and then followed by if you're an overweight person itself in generally, I would really advise an emphasis in terms of swimming, cycling, and then which helps in less stress within your joints and helps in building strength training. And then coming to the diet aspect itself, I think I wouldn't advise too much on it. Apart from the weight loss programs itself, apart from the high protein diet and little low carbs and your protein intake in a vegetarian, that is check your B12s and your Ds, and then have supplements if required B, and then followed by the green leaf vegetables and the micronutrients.
So supplements are important.
Yes. Supplements are quite important, especially when you're a runner, and then you need to have a recovery phase. Like, so many vegetarians are quite commonly low on vitamin B12. So that's why I mentioned that it's always important to get your B12 checked. And if it's low, always supplement it, and then you can get back to the game.
Well, thank you so much, Doctor.
Thank you.
It was a pleasure talking to you.
It's my pleasure. It's my pleasure.
Excellent. Thank you so much.
Thank you.